Well, joining me now to discuss the situation in the DRC is Jonathan Offei-Ansah, who is a publisher of Africa Briefing magazine in the UK. Mr. Offei-Ansah, thank you very much indeed for joining us on Prime Time tonight. New infections then coming from unknown chains of transmission. I mean, how concerning is that?
Well, the greatest danger is that surveillance, will now be running behind, the virus. And when most new patients cannot be linked to a known case, it means that infections are occurring outside the contact tracing system. And people may be treated at home, move between communities, or visit several health facilities before the Ebola, the virus, is recognized. And this creates opportunities for household transmission, unsafe burials, and infections among health workers. And it also means that the official figures may describe only part of the outbreak. The outpouring of the priority, therefore, must be active community surveillance, faster laboratory testing, and rebuilding trust so that people report symptoms early rather than hiding the illness. So, in simple terms, unknown transmission chains mean that the authorities are no longer seeing every pathway along which the virus is spreading. And WHO officials have also warned that the true caseload could be several times higher than reported.
I know viewers will have been seeing pictures of the Africa CDC there whilst you were talking. They, of course, are appealing for more international funding. Is the global response keeping pace, do you think, with the scale of the outbreak?
No, I wouldn't say so. The funding currently available doesn't appear proportionate to either the speed or complexity of the outbreak. And although WHO has reportedly received only about 40% of the $115 million it says it requires for its response, and that figure also actually relates to WHO's needs and does not necessarily represent the full costs facing governments and other humanitarian organizations. And money is also needed not only for treatment centers, but also for laboratories, protective equipment, contact tracing, safe burials, community engagement, staff payments, and operations in areas affected by the conflict. Therefore, the delayed funding is especially damaging because outbreak control is time sensitive. And every transmission chain that is stopped today prevents additional cases, deaths, and expenditure tomorrow. So international partners should therefore treat funding as an immediate containment investment rather than waiting until the outbreak becomes more expensive and geographically dispersed.
Yeah, it's a very good point. I mean, do you think part of the problem is the way in which the international community is thinking about this crisis, is almost categorizing it? Because, of course, we've now seen spreading of the virus to new provinces. At what point does this become a major global concern rather than just people describing this as a crisis only for the DRC?
Well, legally and institutionally, it already is a global concern. WHO declared the outbreak a public health emergency of international concern, way back, on May 17th, 2026, after infections were detected in both the DRC and Uganda. And also Africa CDC, also subsequently declared a continental public health emergency. However, this doesn't mean sustained transmission is occurring worldwide. The more serious threshold would be repeated exportation into additional countries, unidentified community transmission outside the original outbreak area, or cases reaching major transport hubs without being rapidly isolated. In fact, a confirmed case has already been detected in France in a doctor returning from the DRC, demonstrating the possibility of international exportation. And just I think yesterday, a U.S. national also got infected in the DRC, and the U.S. government has prevented him from entering the United States. So the crucial test is whether imported cases generate secondary transmission. Strong surveillance and infection control can prevent an imported case from becoming a new global outbreak.
Yeah, it's a very good point. I mean, over the next few weeks, if the spread does continue, what are the biggest risks, do you think? And what are the things that the authorities need to get right in these next few weeks?
Well, well, do you mean the Congolese authorities or global, health authorities?
Yeah, within the DRC, I think, but also I think more widely, because of course, as you rightly now say, the WHO, there are two other countries you mentioned there. Collectively, what do we need to be doing? What do we need to get right together to make sure that these next few weeks are as successful as possible to mitigate this spread?
Well, the global authorities, I mean, when I say global, I'm talking about Europe, America, maybe Asia, and so on and so forth, must not wait, for this or infection to get outside of the DRC. Like I mentioned earlier, one doctor, who returned from DRC was found to be infected in France. Okay, and this American, national in the DRC has also been prevented from entering the US. Okay, look, chances are if the world, the Western powers do not take preventive, measures, right, it could slip out into maybe the UK, Europe, other places in Europe, America itself, and before you realize, it will become, a truly global emergency. So the funding required needs to be provided, right? There's no use pledging, right, and not making good those pledges, right? The WHO, the Africa CDC should be given the necessary funding and the necessary equipment, all the necessary backing to make sure that the virus is contained, in the areas where where the outbreak is, so like it does not, go beyond, DRC's borders. So to me, that we must regard it as an immediate emergency and shouldn't wait for it to to escalate into a global one.
We shouldn't wait. Wise words indeed. Mr. Offei-Ansah, we thank you very much indeed for your analysis and for joining us on Prime Time tonight. Thank you.
Thanks for having me.